professor of ophthalmology at the Wilmer Eye Institute. I've been there for about 42 years. And my specialty are the blood vessels of the eye. So I have studied their development, and now I'm focusing on their demise in age-related macular degeneration. Specifically, we're focusing on the blood vessels underneath the retina, called the choroidal vasculature, and they keep the photoreceptors, the cells that actually sense light, they keep the photoreceptors alive. So when you lose your choroidal vasculature, you will lose your photoreceptors. So what we've found is that in both forms of AMD, both dry and wet, we lose blood vessels, but the order in which that occurs is different, which is what I've reported at the meeting here. That in dry AMD, it's a secondary loss of the blood vessels, whereas in wet AMD, it appears that it actually happens first and probably creates an environment that is low on oxygen, so making growth factors like VEGF, which we know is an important growth factor for the growth of new blood vessels, like choroidal neovascularization, which is the hallmark of wet AMD. So our recent work, which is not published yet, but that I showed some of at the meeting, is asking the question, why do these blood vessels die? And one of the things we begin to look at is the fact that this choroid is actually a very pro-inflammatory environment, an environment where the white blood cells are activated and sensing all the time for trouble, basically. So we looked at two kinds of white blood cells. We've looked at the macrophages. These are guys that circulate and then they'll settle into a tissue, and they're really the guardians of the tissue. They go around and they look for debris or foreign objects or foreign cells like bacteria. And we find that they accumulate and probably make a lot of this VEGF in areas where choroidal neovascularization forms. But it's interesting. There are many, many of them, which is a number that like 400 to 500 per millimeter squared, that really people had never realized. So they're always in an environment where they can sense basically the beginnings of disease, or they could initiate the disease, which is what our future work will be about. Perhaps more important is a blood cell, red blood cell, not a red blood cell, I'm sorry, a white blood cell, an inflammatory cell, called mast cells, which people don't even know, for the most part, are in choroid. They're throughout your skin. When you get poison ivy, they're the things that make you itch. But there are a lot of them in choroid. And what we found so far is there's a significant increase in these cells in choroid. And they're spilling their guts, more or less. These guys are responsible for what's called degranulation. They release these little granules that have cells which are, that have materials that make you itch, that make your blood vessels dilate or get bigger. And they also have enzymes. And so we think this release of granules, this degranulation by mast cells that we're seeing significantly elevated in AMD, may be responsible for the thinning of choroid, which we know happens in AMD, and perhaps for the death of these blood vessels that I talked about that we're missing, and even, and this is known in skin, the death of retinal pigment epithelium, death of epithelial cells occurs when these enzymes are released. So our work is using, unlike many of the other reports here, we actually use human tissue. So it's not easy to get. We have doctors who have spoken to their patients about donating, like Johanna Seddon, who's a local Boston doctor. And we get the eyes from her patients when they die. But even if we get eyes from her patients or get eyes from a national clearinghouse, it's about $1,500 a pair of eyes. And then a team of people in my lab are ready 24 hours a day to accept them, and it takes about 7 days to process them before we can actually look at them. So it's a very expensive proposition, even though we found good sources that are clinically documented. So part of our need for finance is just to pay for the tissue and then the reagents we use on the tissue, and which results in a really beautiful preparation, at least in my humble estimation, and which we are now able to actually represent in 3 dimensions. We can show the white blood cells and their relationship to the blood vessels. So our future work, we'd like to develop an animal model that could show that this mast cell degranulation actually results in a thin choroid and perhaps the death of the blood vessels in choroid and the loss of retinal pigment epithelium. So it's important in our work to show function. You know, this is actually the cell that's doing this, so that's the only reason that we go to the animal models. But we'll continue with our human experiments, human tissue experiments, and try and develop this animal model. I like the mast cell story that's evolving because there are actually drugs that are formulated for topical administration that prevent mast cells from degranulating, and they're used in ophthalmology. So we think this is true. We actually have enough patients to report that. We'll hope to report it soon. And the animal model will help us to demonstrate that if we give these drugs, that these would have a positive effect. So that's our future directions.
So in terms of what the mast cells...
Let's take a pause.
Pardon me?
Let's take a pause.
Okay.
Okay. Ready? Okay.
So in terms of what the mast cells are releasing, there's obviously a cocktail of cytokines and other substances. Which do you think are most responsible for the majority of the effect, or is that not yet clear?
Well, it's not yet clear, but our hypothesis is that it's these proteases. These are enzymes that break down proteins that maybe are the most important thing, because they would degrade the tissue and they would cause the cell death that we're talking about. But as you point out, it's a cocktail. In releasing these granules, there are granules that have growth factors for blood vessel growth, and there are cytokines that stimulate the other white blood cells, macrophages, to become activated. And there is also this thing they're famous for, which is histamine, which is a substance that causes your blood vessels to dilate. And this is, for instance, when you get poison ivy, you're taking antihistamines. That's why it's a powerful degranulation. They're releasing this cocktail, which has many effects.
Is there any evidence that systemic antihistamines, for example, penetrate that area and have an impact?
Actually, there's a patient that we got, not from Joanna Seddon, but actually from NDRI, which is the commercial source of human eyes, that really ruined our study. This patient had more mast cells than we had ever seen in choroid. It turns out they were fibromyalgia patient. So interestingly, fibromyalgia, of course, makes people, their skin is itching all the time. It's a very uncomfortable disorder, and they have a huge increase in mast cells. Well, she was being treated for fibromyalgia with a drug that quiesces mast cells. So yes, she was taking oral, they're not antihistamines, but they prevent degranulation. And indeed, even in choroid, the mast cells were not degranulated, although they were increased in numbers. And many people before have made the correlation between things happening in choroid and happening in skin. So a systemic would work, perhaps. I mean, there's no question that drugs would get there from this example, for instance.
There have been studies done quite a long time ago looking at steroids. And obviously steroids are a huge mallet compared to a much more targeted antihistamine preparation.
Yeah, and steroids are dangerous.
Yes.
Because in the eye they cause cataract, they cause glaucoma,
Right.
and increase in intraocular pressure. Another aspect of our studies, which the early studies hopefully will be published soon, is to try and quiesce mast cells and macrophages with a nanoparticle called a dendrimer. And my collaborator, the biomedical engineer that makes these, has actually put steroid on these dendrimers, and very effective local quiescing of macrophages occurs. The beauty of the dendrimer delivery, which we are going to be able to give systemically actually, is that they seem to only go to and be retained by activated macrophages. And the rest of the body clears the dendrimers within 24 hours. So this would be a way of delivering a steroid or other small molecules that we're looking at that would only focus on these inflammatory cells and not any other cells in the eye or in the rest of the body.
Well, that sounds remarkable. A highly targeted vehicle for potential therapeutic applications.
That's the goal. And targeting, and this is the amazing thing, there's no actual tag on there or target that makes them go to the macrophages. It's just a natural process. These guys are always, as I said, they're always sensing the environment and take them in the sensing process. But the curious thing is they retain them where other cells do not. So we're really excited about that. That's